All right, I'm going to go ahead and get started here. Hello and welcome, everybody. This is William with O'Neill Marketing. We really appreciate everybody tuning in. We're happy to have your attention for the next 30 minutes as we hear from David about the products offered by UnitedHealthOne. We're very excited about the presentation today because we truly believe that every ACA plan can benefit from some supplemental insurance. Always an opportunity to make someone's plan better, and as agents, we should be discussing how we can create the best possible plans for our clients. So not only will this help create better plans for your clients, but you'll also earn more commissions if you get in the habit of building supplementary sales into every discussion. So if you have questions during the presentation, feel free to type them into the Q&A section on the left hand of your side, and David will address them at the end of the presentation. Thank you again for everyone for joining us today, and I'll go ahead and turn it over to David.
Thank you very much, Will. I'm happy to be here. So what we're going to talk about today is obviously when you're selling your customers their marketplace plans and such, is adding ancillary products to their portfolio. We found it very important to make sure your clients have the most robust coverage, and we have some really good options for you to offer. Why sell it? I mean, first off, consumer out-of-pocket has increased. As you know, the out-of-pocket exposure for your clients has increased by about 43% over the last 10 years. And when we survey customers and find out, what's very or somewhat difficult for them to afford to pay, number one is out-of-pocket for their health insurance, and number two is dental, and they're closely matched there. And then we go into vision and hearing. So the top three things are really what's the most difficult things for them to pay, with as time goes on. So the ancillary products we have available, and we have dental, which is by far our most popular ancillary product just to sell and for the clients to get. We offer those for both pre and post 65 customers. So for those of you who do Medicare, we have dental plans available for them. And we have 12 different plan choices of both pre and post 65-year-olds. Vision, we have glasses or contact options, and then we have glasses and contact options. Accident plans, critical illness, and then we have fixed benefit plans, and then also non-health insurance products like telemedicine. So dental, for one thing to know, dental plans are guaranteed issue, right? So, anybody who applies gets approved. And think about this, 156 million Americans do not have dental coverage right now. If you look at 42% of adults who report visiting dentists less than one time a year. That's probably in me. I go at least once a year. I'll go for my cleanings. And then you look at 40% of children younger than 3 have never seen a dentist. So, if 80% of Americans will have at least one cavity before they reach age of 17. That's why it's very important for dental plans to be offered to your clients. We can get a little bit more into the weeds, and really there's so many health issues that people have that kind of start in their mouth, right? It's not just about your dental hygiene, but that can affect other parts of your health as well. So where do we offer dental? Pretty much the entire country. So we have 47 states where we offer dental plans. The 3 states are Massachusetts, New York, and Montana, where we don't offer dental. But other than that, we have dental plans. I mentioned we have 12 different plans. We're not going to cover all of our plans, but this kind of shows you, kind of what we're looking at. We had the premier plans and the primary plans for under 65 years old. If you look at some of the options we have, I mean, so you're looking anywhere from, $20 to $45 for coverage for a plan, right? So if you look at the least expensive plan, which is our dental primary plan, it gives you immediate coverage for preventive, basic, and major services, okay? We have different options anywhere from $1,000 to $3,000 of annual maximum benefits, okay? Dental implants are covered on our Dental Premier Plus plan. So you can see there a sample premium is $45 a month, which also includes orthodonture. So, orthodonture is a 12-month waiting period in that. But it is covered. And then all of our plans use the UnitedHealthcare National Options PPO 30 network, which I can tell you it's the exact same network that me as an employee utilize. So a very robust network with UnitedHealthcare, of course, nationwide. So even though we only, there's 3 states we don't offer it in, the network is nationwide. But again, you can kind of see here a cross the bridge premiums for the different dental plans we have. Quite affordable for your customers. Hearing and vision. Hearing benefits are included in our dental plans, okay? For under 65-year-olds, they get discounts on hearing exams. They get a 45-day trial if they need hearing aids, and they also get a 1-year supply of batteries. The vision is a rider on the dental plans. It's administered by Spectera, right? So it's that network there. Eye exam, they get 1 eye exam a year at a $10 copay. Frames and lenses, they get once a year. They get a $10 copay for lenses and a $150 allowance for frames. Again, I can tell you that that allowance for frames is actually more than mine as an employee of UnitedHealthcare. Our allowance is less than $150. And then contacts, they get contacts once a year as well, and there's no copay. No copay as long as they choose a select contact lens. We also have Vision Standalone. Vision Standalone, approximately 12 million over the age of 40 have vision impairment. Okay, there's just in vision really, it's so obviously a lot of you are probably talking to your customers over the phone. So if you're doing like a virtual, shopping experience with them where you can see them, well, like I wear glasses, so that's pretty simple. If someone's wearing glasses or they have contacts, it's automatic. They need to add that vision benefit. It is, to me, the best benefit we have. It's inexpensive, and the benefits that they receive far outweigh the premiums they pay. Standalone vision, we have in 44 states. Again, you have a vision rider on your dental plans, which is the way you should go. But if they just want vision, then we do have standalone vision plans. We have Plan A, which is like I talked about earlier, with the $10 copay for the exam, your glasses and contacts, and that one is $11.40 for that vision and dental plan. I'm sorry, the vision plan. Or they can choose Plan B, which is $15.70 a month, and that gives them glasses and contacts every year. So the difference is, again, if they add vision to their dental plan, that's a $6.50 premium per month to add vision onto their dental plan, and it gives them both glasses and contacts. If they want to choose a standalone vision plan, then they have the option of Plan A or Plan B, and the premiums of $11 or $15, depending on which one they want to do. Accident plans, you'll see our accident plans in 39 states. And we have different options for there. And the key thing is there's guaranteed issue options on every category. So we have accident expense guard, which gives them an accident benefit. They choose from $5,000 up to $20,000 of accident benefit, guaranteed issue. And then they have a matching benefit for accidental death and dismemberment. For the Accident Pro Guard, it's a little more robust. It gives them an accident benefit of either $5,000 or $10,000, and then a critical illness benefit anywhere from $10,000 to $50,000 for critical illness. So your heart attack, your stroke, your cancer, loss of limb, so for your critical illness benefits. And then we have Accident Pro Gap, which again is your accident benefit. It matches whatever you choose for your accident benefit. It matches the AD&D benefit, of course. It also matches your critical illness. So if you choose a guaranteed issue $5,000 accident on the Accident Pro Gap, you're going to get a $5,000 accident, a $5,000 accidental death and dismemberment policy, plus a $5,000 critical illness benefit. And then what separates the Pro Gap is you also get a $2,500 hospital admission benefit for sicknesses. So as you can see, this is a great product to pair up with an ACA plan with their out-of-pocket exposure, because again, if they're admitted to the hospital, this alone is going to pay $2,500 to them if they're in there for an illness. So the accident, what does the accident coverage? So it'll pay out a benefit for any treatment for burns, lacerations, diagnosis concussion, emergency visit, or urgent care visit within 48 hours of the accident. Along with that, within 30 days of treatment of the accident, for ambulance rides, anesthesia, doctor visits, fractures, hospital stays, labs, x-rays, MRI, CAT scans, prescriptions, prosthetics, and surgery. Okay, so, somebody, falls and injures themselves, well, they might go to the emergency room or urgent care right away. But sometimes, like, okay, I fell and hurt my back. After a couple of days, like, okay, I really did something to my back. So then you go to the doctor. So that's why it's 30 days within treatment for doctor visits and labs and x-rays, and then the 48 hours for going immediately. If you break your leg, obviously you're going to the emergency room or urgent care right away. Accidental death and dismemberment. Of course, if there's a death resulting from an accidental injury within 30 days of an accident, then it pays out 100%. Or if you lose any of your limbs, then it'll also pay a benefit for that. The critical illness, which was included in the Pro Gap and the Pro Guard plans, there's 14 triggers, okay? And it actually can pay out 3 times. So what that means is, let's say I chose a $5,000 critical illness benefit on the Pro Gap or Pro Guard plan, and I have a stroke. I'll get paid $5,000. Well, let's say 6 months later, I have a heart attack. I'll get another $5,000. And then let's say down the road, I get cancer. It'll pay another $5,000. So each category, heart attack, stroke, invasive cancer, and so forth, each of them is their own separate category. And we'll pay up to 3 different categories. Okay, so if you have a stroke and it pays that category, then you won't get paid for stroke again, but you can get paid for 2 others. So as you can see there, a $5,000 critical illness benefit can actually pay out $15,000, just like a $50,000 critical illness benefit could pay $150,000. Where do we offer the Accident Safeguard series of plans? In 34 states. Critical Guard. Now this is a brand new product. This actually isn't launched yet. This will launch a week from Friday. So September 22nd is when it launches. So it'll launch in 31 states. We have more states filed, we're just waiting on approvals from them. And again, on the critical illness, on the Critical Guard plan, we have guaranteed issue options as well. So if you'll notice, everything I've shown you, the dental vision plans, the accident plans, the critical illness plans, they all have guaranteed issue options in there. Because we all know, when we're working with customers on the ACA plans, many of them have health conditions that might normally exclude them from these type of benefits. So everything we're showing is have guaranteed issue options. And so you can see there, the critical illness guaranteed issue for ages 18 up to 74 years old is guaranteed issue options. Then if they want to get more, we do have simplified issued options for them, where we'll do a claims check. We'll have a height and weight chart, which means we can decline them. So if your customer's pretty healthy, you might want to go with a simplified issue product. That way you can go with a higher benefit. But if it's something where they do have medical conditions, the guaranteed issue might be the right way to go. And so with these, you have 4 different types of plans. Again, guaranteed issue options on all of them. You can sell a cancer plan. So therefore, they would have coverage, a payout for cancer. And then they also include a maternity benefit, a COVID benefit, Optum Cancer Service. So, and then also an Optum Perks card to give them discounts on prescriptions. If they choose the heart and stroke plan, they'll get paid out for a heart attack or a stroke. They also get included the pregnancy benefit, the COVID benefit, the Optum Heart Service benefit, and the Perks card. If they choose the cancer, heart, and stroke plan, they get both of those. And then the critical illness plan, they get their cancer benefits, their heart and stroke benefits, as well as benefits for ALS, Alzheimer's, if they're in a coma, major organ transplant, and end-stage renal failure. And then all the plans also have optional benefits for a wellness benefit where they can get paid to have their wellness visit. So, obviously with an ACA plan, their wellness is at no cost, and they could actually get reimbursed for that wellness benefit. And then prescription indemnity, so they'll get paid for getting prescriptions filled, and then also our telemedicine rider. So that is just, a brief overview of some of our ancillary products, right? So our dental vision, our accident, and our critical illness plans. Now, I do want to point out that all of these products are through an appointment with UnitedHealthOne, which is a division of UnitedHealthcare. So this is a separate appointment than your ACA appointment through O'Neill Marketing. Okay, so and if you need to get contracted for these products, then you see the added benefit to add onto your clients' plans. Please reach out to them, and they can get you appointed for these. So one of the questions I do see is, do we offer a hospital indemnity plan? Yes, we do. So we have Health Protector Guard as well as Guard plans. So anywhere from $500 up to $3,000 reimbursement for hospital stays per day, as well as other benefits. And there are guaranteed issue options in there as well.
Thank you very much, David. Let's say I'll give another second. If anybody has any other questions, go ahead. Feel free to put them in the Q&A section here. Anything else that you guys would like to ask? I'll give you guys another minute to go ahead and post those there. All right, I'll give one last chance for any questions to get answered here.
Yep. Will, I do see one about short-term plans. Yes, we do offer short-term plans as well. So we have anywhere from 6 months, depending on what state you're in, we have anywhere from 6 months to 3-year, 1 day short of 3-year plans.
David, if you email us these slides, we will send these to all of the agents, okay?
Yes, I did send them right before.
Oh, perfect.
Yep.
Excellent, beautiful. Well, any last questions for David before we wrap up here? Just one more second. There we go. All right, excellent. Well, thank you very much, David. Everybody, we really appreciate you all joining us today for this UHO webinar. If you're not already an agent with O'Neill Marketing and you'd like to join us, please go ahead and reach out to our team. We can discuss onboarding. If you would like a UHO appointment, you can go ahead and request that right from your agent portal, and our contracting team will get everything started for you. As I mentioned, we'll be sending out a copy of the slides after the webinar, and then we'll be posting a recording and the slides on the agent portal. So again, if you're not already appointed with UnitedHealthOne, I would highly recommend you do so. These products are so important to offer, and they pair very, very well with ACA plans. So thank you again, David. We really appreciate your time. We appreciate you coming out and giving this presentation for us, and we really hope our agents will be taking advantage of all the products and the opportunities that are provided to us by UnitedHealthOne.
Thank you so much, Will.
It's our pleasure. Everybody take care now. I hope you all have a fantastic rest of your afternoon.